Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us on the program today. Our guest is Dr. Diab. He's lead trial investigator, Department of Melanoma Medical Oncology, the Division of Cancer Medicine at the University of Texas. And he's joining us here today on the program to talk about Idera Pharmaceuticals' presentation of some data from the ongoing Illuminate 204 trial. Welcome to the program, Dr. Diab. Thank you for taking the time.
Good morning, and thank you for having me. As you mentioned, my name is Diab. I'm a medical oncologist at the University of Texas MD Anderson Cancer Center. What makes us really interested in the approach of using the Tilsotolimod drug, which we'll explain about in a second, is the background of what's happening in the cancer world and what's happening with the immunotherapy impact currently. As you know, there has been a revolution with the use of immunotherapy to treat cancer patients, mainly using what we call checkpoint inhibitor, drugs that block the CTLA-4 pathway and that acts on the T cells, a subset of immune cells that specialize in killing cancers in addition to killing viruses, and also a PD-1/IL-1 blockade agents that also have a significant activity in treating multiple cancers, including melanoma, non-small cell lung cancers, bladder cancers, and other diseases. However, the problem with these great immunotherapy drugs, they are limited activity. And their limited activity comes from the background that these drugs, first of all, they don't kill the cancer directly. They activate the immune cells to kill the cancers, in particular activate the T cells, the subset of the immune cells specializing in killing cancers. But they rely on the T cells first and foremost to recognize the cancer as a problem. And cancer in nature is not a foreign invader, is not a virus or bacteria. It's a self-tissue that decided to do bad things by growing in the wrong places and invading the other organs and growing there and interfering with their function. And ultimately, if that continues, they are lethal. But in a sense, these cancer cells are a self-tissue, and the immune system at large is not programmed to attack self-tissues. And that's where the limitation of T cells as a subset of immune cells to recognize the cancer as a problem or as invaded, because it's not. And then that will limit the checkpoint inhibitors activity, the anti-PD-1 and the anti-CTLA-4, because they only act on T cells that already activated, recognize the cancer as a problem, and then inhibit it at the level of either CTLA-4 or at the level of PD-1. And these blocking agents will inhibit that inhibition, allowing the T cells to continue and resume their killing of the cancer. But as we mentioned, most cancers do not look like foreigners. Most cancers do not trigger the immune system to attack them because they look like foreigners or they look like invaders. And then there is no T cells that activated and recognize the cancer, and then there is no effectiveness of the checkpoint inhibitors to activate those T cells. So what we wanted and what we really need is a drug that activates the immune system first to recognize the cancer as a foreigner. And then that will trigger an immune response mediated by the T cell. And eventually, we can use the checkpoint inhibitors to unleash those T cells and resume their killing. But the recognition part of the cancer by the immune cells is the missing link, and it is a major problem for most cancers. And what Tilsotolimod is basically a drug that activates the toll-like receptor 9, which naturally that toll-like receptor 9 or TLR9, its natural function is to recognize viruses and recognize other certain bacteria that invade the body, and then set the alarm to activate another set of immune cells called innate immune cells, in particularly dendritic cells and macrophages, and those will attack the cancer and have a better presentation of the cancer as a foreigner to the immune cells, specifically to the T cells. And then the T cells will come and recognize the pieces of cancer on the macrophages and the dendritic cells. They will get activated. At this level, these T cells now have intelligence of how the cancer look like. They know that the cancer is an abnormal process that needs to be attacked. And once they recognize that cancer, they travel everywhere in the body to look for other similar cancer cells and destroy them. So basically what Tilsotolimod is acting as an intelligent material to give more information about the cancer as a foreigner and activate the right immune cells to further characterize the cancer and present it to the real soldier of the immune cells, the T cells that eventually destroy the tumor.
Does this drug work alone, or is it in conjunction with other drugs or with other conventional therapies?
Yeah, this drug is not designed to work alone in this situation, as I said, because it is injected intratumorally, and its main goal is to activate those alarming cells that surround the tumor and present pieces of the tumor to the T cells. The T cells are the main soldiers that can travel everywhere in the body and kill the tumor. So the drug is injected intratumorally inside the tumor and activate those dendritic cells and macrophages, and then the presentation will happen to the T cells, and the T cells will travel everywhere. Now the T cells, when they start getting activated after they recognize the cancer, because Tilsotolimod was injected, they might have inhibition at the level of CTLA-4 or at the level of PD-1. And that's when checkpoint inhibitors that block CTLA-4, such as Ipilimumab or anti-PD-1 agents, all of them can be complementary and allow this process to progress and become eventually effective treatment and eradicate cancer cells.
And where can our listeners go online and learn some more about Idera Pharmaceuticals and this Illuminate 204 trial?
I think there is a lot of websites where they can learn about toll-like receptors, but I think Idera has a website, has a very nice cartoons that can explain the process that I just described right now. And they can learn a lot about this process and this drug specifically from their website.
Well, I thank you for coming in and speaking with us this morning, Dr. Diab. Is there anything that you'd like to add with just about a minute?
Yeah, I think this is very exciting times for us to see what we learned all the time from our experiments in mouse that's being translated in a human. But it is very important to know that these direct translation of so many years of knowledge about the immune system, how to attack viruses, now being applied in a human to see how we can learn from that and attack the cancer cells. And so far, we are excited of what we're seeing.
Well, thank you for coming in again, and it's been a pleasure. Thank you so much.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.